Okay.
Hello, everybody. This is Dr. Deb Davies, licensed acupuncturist, birth doula, childbirth educator. And today I have a lovely friend with me, Elise. And do you want to introduce yourself for a minute?
Sure. Yeah, hi, I'm Elise Lasko. I am an acupuncture student at Pacific College of Health and Science. I'm kind of on a similar track to Deb and reached out to Deb recently out of curiosity. I'm very interested in learning fertility acupuncture and women's health and pregnancy. And one of my supervisors at school talked about Deb during one of my shifts. And I got really curious. And so I reached out to Deb, and we've kind of just been having some conversations about women's health and preparation for pregnancy. And I just got really curious. So thank you for having me.
Yes, this is kind of fun. I feel like I wind up saying a lot of the same things over and over. So whether this is helpful for, we kind of wanted to have this really be about what do women need to know when they're starting to think about getting pregnant, when they're starting to think about having a baby. And so I have the same questions asked a lot. So I thought this is a great opportunity to just have you ask the questions. We can record it and then share it with everybody. And maybe this will help someone. That would be the goal, is that we are able to help someone, a family or two or hundreds would be awesome. So
Yeah, I'm
yeah,
excited.
yes, thank you.
You're
So let's
welcome.
just dive in. What do
Okay.
you want to know?
Yeah. So I guess, thinking about my own journey, I'm 33 years old and I'm starting to think about my own, well, beyond just fertility, but thinking about having children myself. I'm in school and thinking about the right time and all of that. And I think for a lot of other women my age, we've just been taught most of our lives to just abstinence, and you don't really have to worry about it until you're like actually thinking about it. But nobody teaches you how to plan for pregnancy and your body. And, I just learned about really tracking my cycle 2 years ago when I was 30. Um, and I've just kind of, as getting into Chinese medicine and acupuncture and doing my own research, I realized like, everything that I knew about birth control and abstinence, I'm like, this is not the way. And I feel very empowered to, empower myself, but also others, and sharing with others how important it is to prepare your body long before you're actually even thinking about getting pregnant. So could you speak a little bit to that? Like, what can women do, even if, if they want children someday, or, even if they're a couple of years out? And maybe that's two different questions.
Yeah, no, I think it's really common is we, as women, we want to do the best for ourselves, for our babies, our future babies, our bodies. So there is things that we can do. And I feel like there's a lot of education we could if we could roll it back and talk to the teenagers and young women as they're becoming women and starting their menstrual cycles, things like tracking your cycle and just writing down the days and knowing how many days apart that is, how many days you bleed. We have apps now. There's so many apps that you can use for this kind of thing. If there's clots, if there's cramps, different signs and symptoms. And then, things like, so in Chinese medicine, we always ask the question, do you run hot or do you run cold? And we talk a lot about yin and yang in Chinese medicine. So it's kind of like the opposites. And so we want to know if people are running hot or cold. And then oftentimes what I hear with a lot of my fertility patients is that they're cold, that they run cold. And it's like a joke with their husband. They freeze them out with their feet in bed or something like that. And so then my next question is, tell me about your diet. And so they'll say, oh, I eat so healthy. I had a smoothie for breakfast. I had a salad for lunch. And what I think in here is cold, 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 cold. And so when you think about preparing for pregnancy and you think about the bun in the oven, like everybody knows that saying as it relates to pregnancy, the bun in the oven. But if a bun doesn't grow well in the fridge, so when women are running cold and are eating cold, that can make it a little more challenging. And oftentimes this one change in people's lives seem to make the biggest difference for so many. So for example, better to have room temperature water than iced water, or better to have an apple that's on the counter versus an apple straight out of the fridge. No iced beverages. Here in the US, it's so common to just dump ice in everything. And that's really not good for our digestion. We need that warmth, the transportation of food and drinks into nutrition for the body requires warmth. And so we would recommend, you have some eggs, or you have oatmeal for breakfast, or congee is like a rice porridge. You could put, berries or nuts, and you could have it sweet or savory, many different options. Or if you're going to have that salad, maybe you have it with grilled chicken. Or if you're going to have that smoothie, maybe you have it with a cup of ginger tea, something to offset it. So really getting your body in homeostasis as much as possible would be something to consider. You could absolutely consider working with an acupuncturist on someone of a regular basis. And I could just share countless stories of women who have a difficult time getting and staying pregnant. And so that's the other thing. It's like when you take the time, like what you're talking about now, to prepare your body for pregnancy, like preventatively, it's going to help you not only get pregnant, but stay pregnant and then carry to term, and to be able to give birth, and you and your baby to both be healthy and mentally, safe and sound, happy, all of that. So it's kind of like the whole way through. So the more that people do the planning, I think the better off they are. And education is really the key, which is why we're talking. We want to help share this information with people that need to know it.
Yeah, I love that. It's such an amazing point about, and it's something so simple, the diet change. And any other students of Chinese medicine probably know this really well, but it's something that I didn't really think a lot about until really going to school. But also, I love Ayurveda, and it's all about, it's an ancient Indian style of healing and eating. And Ayurveda is also very big on not eating cold food or pairing. And it's just something very simple that I didn't really know a lot about, is the warming food. And it makes so much sense. And that was something that you and I have talked about previously, Deb, is just the little things that women can do. And I'm sure also men, this little lifestyle changes that can make a huge difference in your body. And so I think that leads me to my next question around, preparing your body. So like you said, getting the bun in the oven, warming your body up. So if a woman is, in this culture where birth control is very prominent, what is ideal for women who are currently on birth control that want to get pregnant one day? How much time is needed for the body to come to that homeostasis from going off birth control to getting pregnant and trying to get pregnant?
Yeah, that's a great question to ask. And my personal recommendation is, for every year that you've been on some kind of pharmaceutical birth control pill, is which most women are on, most of the patients I've worked with, is for every year that you've been on the pill to take 1 month off. So sometimes this is horrifying for a 42-year-old woman to hear, and she tells me she's been on birth control for 20 years. So this is good to hear at some point. So the realization that it might be time to go off birth control. If you're thinking about getting pregnant in 2 years, maybe that gives your body chance to process and move through and get rid of, and all of those things. That's my personal experience with it. I have seen things work quicker or even take longer. So it just depends on the woman's overall state of health. But it is something I would have them start to think about, is that you want to get off the pill to achieve pregnancy. And I know it's a delicate dance, because then what? I guess you could use condoms, or you could plan knowing your cycle, being more careful certain times of the month, that kind of thing.
Yeah, and that's something that's really interesting, because I've heard such a range from friends who have gotten pregnant. Some say, oh, I got pregnant the first time right after I went off birth control. And then
Mhm.
there's others who say it's taken them 2 years. I'm curious, would you say that's also general state of health? Like what is that? How does that happen so differently in different women?
I think it can be an overall state of health. And, these days women are waiting longer and later in life to have children. So the overall health of a 30-year-old versus an overall health of a 40-year-old could be significantly different. So I think that the older we are, the harder it gets. But there's things that people can do to help put their bodies into balance. I really am a firm believer in acupuncture, getting some kind of regular treatments, whether it's once a week, once a month, every other week, with some sort of consistency that will help. Number one is regulating cycles. So it really makes me sad when I hear about women who have these horrible menstrual cycles, and it's normal for them, and they accept the pain, the cramps, that I got to call out of work, I'm on the couch, just give me my meds, leave me alone, that they just accept that as normal. And I'm so amazed with Chinese medicine in the field of obstetrics and gynecology. I believe in Western medicine. If I get into a car accident, if there's an emergency, of course I'm going to go to that emergency room. But for the most part, there's a lot of things we can do to naturally balance our bodies to be in a better state of health. So, it's so basic, because acupuncture is all about nature and mirroring nature and balance. So what I'm seeing is women coming to me, in their 30s and more often 40s, because they waited so long to find the guy, to get their career going. And I get it, I totally get it. But then they want to have a baby, and it's so much harder. So I think that it is wise to think about, they talk about conscious conception, conscious planning, conscious pregnancy, conscious birth. And the more energy you can put into planning for it. And the other thing to think about is the guys, the dads, they're half. You think about it, that moment of conception, the moment the sperm and the egg meet, boom, half the baby's health is determined by his health and your health at that very moment. So much emphasis placed on the women. I think, the guys could use a little support too, in
Totally.
if it's acupuncture or whatever they're doing, some kind of stress reduction. Sometimes it can be very stressful going through fertility, pregnancy, postpartum. And so having outlets for that, whether it's your friends, your weekly poker night with the guys, or you have a therapist that you talk to on a regular basis, you get to go up to a dance class or yoga class once a week, that there's something. I ask a lot of people, what do you do for fun? Like, I'll ask that in the clinic, and a lot of times they laugh at me. What? I just work. I'm an attorney. I work 80 hours a week. And, there's something in Chinese medicine that requires both the heart and the kidneys to communicate, to be able to create a baby. So the more that people can be in love and be in touch with the situation, I think the better it can go and be for the entire family.
Wow. I mean, there's so many things that you just said that I want to dive into more. The heart and kidney not communicating is something I recently learned about, and it's so fascinating. I'd love to know more of that, but I'm going to keep it more simple, just because the average person who might not, fully know a lot about Chinese medicine, that might be a lot to dive into right now. But something you were talking about is regulating the cycle with acupuncture. Can you speak a little bit more to how does acupuncture do that, and why is that important for, to regulate?
That's great. Regulating your cycle is very important because, well, if you think about, the average pregnancy is 280 days. Now you look at that, and that is a 28-day cycle times 10. So that's the average, number of days for pregnancy. So something that I've seen clinically working with acupuncture, Chinese medicine, the last 20 years is that if a woman has a shorter cycle, like maybe she has a 25, 26-day cycle, she may have a shorter gestation, because if you did 25 times 10, that's 250 days. Now the challenge arises is if her cycle runs late. So now if she has a 30 to 32 day cycle, so that's 300, 330, it's too many days.
320.
Like in the state of California, they will allow us to go up to 42 weeks, 296 days. If you have a 30-day cycle, your body might take 300 days to gestate. And it's almost considered over, there's so many risk factors of babies going over due dates. But I think that more concerningly is there's so much fear placed into the birthing mama and the birthing world, like that it's something they can't handle and that they need, they need help with, and that the doctor's going to deliver the baby for them. Like, come on now. What do you think of when you think of delivery? Like pizza? Amazon? Are you kidding me? I think women birth babies and the doctors catch them, but it's the doctors aren't doing the work, really. I mean, the woman's doing the work. Anyway, don't get me started on birth. I think I might have derailed that question. Okay, so we talked about cycle regulation. So the cycle.
Well, you said something.
That's okay. That's why I was saying the importance of regulating. That's why I was telling that story, because if your cycle's long, the concern is that you could have a longer gestation. And in most places, women are being induced at 39, 40, 41 weeks instead of physiological, natural labor starting on its own, doing its own thing. So it's almost a challenge these days to have a natural birth and a natural physiological birth in a hospital in the United States.
Yeah, I think that is such a great point. I had no idea. I didn't even think about that doctors don't let you go longer than those. I did not that your cycle being equal to the length of gestation. That's super interesting to me. And so that kind of leads me back to what you were saying about acupuncture helping to regulate the cycle. Could somebody getting regular acupuncture if they have a long cycle, could it help to shorten it a little to also bring about that result of being able to gestate under that time or within 296 days?
Yes, no, it's exactly what happens. So oftentimes when I have a new fertility patient, I say, let's talk about having regular treatments for 3 or 4 months. It takes about 120 days for a red blood cell to rebuild in the body. And so we're kind of, preparing the palace, preparing for pregnancy, rebuilding the blood cells of the body so that she can, optimally get pregnant, stay pregnant, carry to term, have a healthy baby, and a healthy mom at the end. So the things that I will see in that 3 or 4 month period of time is if her periods are early, they'll start to lengthen. If they're long, they start to shorten. A good period will just start with fresh blood and bleed and then stop. It will not be spotting on either end. Oftentimes women have spotting on either end. It could be brown or, pinkish reddish spots. That is not ideal. And then cramps. So many women have debilitating cramps or clots in their menses. And while pre-TCM, I didn't look at my period blood either, but now it's really interesting once you study it. Like I need to do this where I have a swatch of paint colors, because period blood can be pink, it could be red, it could be bright red, it could be brownish, it could be merlot, kind of purplish, it could be black. And it varies between months and women, and it all means something. So there's so many things that we can do to regulate. So another thing, if women have clots in their periods, most time, if a woman has clots, she's not going to get pregnant. And that's my experience of 20 years. If she's telling me she has clots,
Wow.
like the first thing that I want to see change in her period is that she doesn't have any more clots after a month or so. And it's truly amazing when somebody commits, comes in weekly. And, you know, we could talk about adding in Chinese herbal formulas. We could talk about diet, those kinds of things. And there's a lot of nutraceuticals, vitamins women can take to help benefit their bodies, their, you know, vagina, cervix, vulva, whole reproductive area, to just juice it up as much as possible, really, to get them ready. So yes, Chinese medicine is stellar. And, you know, I dare say that Chinese medicine excels over Western medicine when it comes to the field of obstetrics and gynecology. It provides a lot more options than what that is currently out there. And or integratively, like if a woman wants to do IVF or IUI and she has the funds and everything, acupuncture is an incredible adjunct to that, because getting acupuncture just pre and post insemination increases that chance of that woman's pregnancy holding by like 66%. So that's huge. And there's just so many more things that acupuncture can do. So I'd love to scream to the world and share and just let people know, like, there is help. And so many women that I see say, oh gosh, I wish I knew you when, before I was pregnant, with my last pregnancy, whatever.
I love that. Yeah, I mean, it's all so fascinating to me, and just all the things and all the options there are with acupuncture and Chinese medicine is, you know, Chinese medicine is the umbrella. Acupuncture and herbs and, you know, everything else that comes with that, you know, is also nutrition goes within Chinese medicine, and it's amazing how integrative it is. So, you know, we're kind of coming close to the end. I'm just curious. So, if somebody, say that somebody my age is in a similar situation who wants to get pregnant in the next couple of years, what should their like first step be? Like step one, maybe even 2 or 3 steps, whatever you think is the ideal. How do, yeah.
Well, if you're a couple years out, you know, so let's say 2 years or less, I would say to, you know, get off birth control, to regulate your cycle, to try to get that cycle regulated as close as you can, 27, 28, 29 days, you know, something right in there, optimally. There is herbs, you know, Chinese herbs you can do. There are, there's just so much you can do to improve your quality of health. So things that are out of balance, like if you feel extremely cold or extremely hot, that needs to shift. You know, we need to get you into that homeostasis. If you are smoking, drinking, you know, anything, you could consider reducing or eliminating those habits. If you are a runner, maybe you can start to look into yoga or some other less.
Why no running? I'm curious. Why no running?
Well, I've just seen so many miscarriages early on with runners. And I mean, so they say, I think the kind of rule of thumb is if you've been doing it, you go right ahead. But
Yeah.
it's really hard on our bodies. It's just really hard on our bodies. So I think that if the woman can, so pregnant women love yoga, stretching, walking, and swimming. Those seem to be the most common things that we see. So I'll give you a story of a woman that was 33, actually came to me, and she was crying the first time I met her. She said, all my friends are getting pregnant. It's not happening to me. I don't know what's happening. I've been married 2 years. I want a baby. Help me. So we do this interview, and I So tell me about your workouts. Oh, I do CrossFit. I love it. And, 3 or
Mm.
4 days a week, I'm killing it at the gym and blah, blah, blah. And so CrossFit, running, I'm going to put them all in the same category. Would you be
Intense
willing?
exercise.
Yeah, intense exercise. Would you be willing? And the reason I say it is you only get so much energy in your life. So it's like, to try to build a baby, it takes a lot of energy. So anyway, this woman was coming to me. She really wanted a baby more than anything. She was willing to completely change her diet, stop doing the cold. And I knew that the CrossFit was a thing. So I was like, would you be willing to look into yoga? She started doing that. She stopped with the CrossFit. And within 2 months, she got pregnant. And she got pregnant naturally with twins. So it was beautiful.
And I think, am I still with you, Deb?
I hear you. Can you
I
hear
said
me?
my connection. Yep, my connection went off for a second. We talked about earlier is that there is really like just of Chinese medicine. It's a lot more than just puncture or herbs to promote your overall body health in order to make the right environment for a baby. That's no.
I think you cut out there for a second.
Come on.
I know.
One moment.
I see. I can hear you, but you're frozen on the
Okay,
screen.
am I back?
You're back. I hear you. Okay,
Okay,
now I
great.
can see you too.
Okay, cool. Am I good now?
I think so.
Okay, we're back. Sorry about that. My internet just decided to not connect for a second. Yeah, I think just, coming to, conclusion, I think this was just really great knowledge for me. I think sometimes these very simple things, they seem obvious, but the average person might not know. And even for me and for other students that I've talked to that may be in tune with health, you hear these little things like, oh, if you eat a lot of cold, you got to warm up your body and eat warmer. It's like, oh, I never would have thought about that. And I just find that is
Most people would never think of it either. It's so they're like, wow, I would never think of that. So, and that one thing can make a big difference in a lot of GYN issues, from excessive bleeding to, fibroids, this and that, all sorts of problems.
wow. I love it. So I guess in conclusion, is there anything else you want to share with women who are just getting started? I know we have some simple steps of, anybody who's thinking about getting pregnant in the next couple of years is getting off birth control, regulating the cycle, regulating diet. Anything else you want to share with everyone today, or what is the best way to get in contact with you if they want to learn more?
Yeah, thank you. I think another thing to consider, like when they're planning ahead, is where do you want to give birth ultimately, and looking into, statistics of what's happening in the birth world, and getting a better reality on, or understanding the current reality out there. So some of the places with the most marketing dollars, people think are the best places to birth, but it's not necessarily true. And so really looking at what the mom herself wants. So if a woman wants a natural unmedicated birth, there's things that you can look into. Most women are not aware of the fact that midwives care for normal, healthy women having normal, healthy babies. And doctors care for sick moms and or sick babies. So you do not need an OBGYN for pregnancy. You do not need to necessarily give birth in the hospital. If you're planning a natural birth, it's actually difficult to give birth naturally in the hospital. And so, thinking about those things, and you can interview different doctors, you could interview different midwives or look into birth centers, whatnot. there's a huge birth community out there online. I'm in San Diego. It's huge here. And there's just so much connectiveness worldwide to support birth, physiological birth, natural birth, supporting women's rights, their right to choose how they birth. And it's just so important because so many women come to me very late in a pregnancy and not able to make shifts to have a good birth. And really, like, my story was that I lost my first child. I had a stillborn at term, and this is almost 21 years ago, and it rocked me to my core. You know, it was by far the worst thing that's ever happened to me, and I wouldn't wish that upon my worst enemy. However, I think that there's a very high maternal mortality and infant mortality death rate in the US. And I don't think that having all of the technology and all of the things that we have is necessarily producing better outcomes. And in fact, it's quite the opposite. And, you know, I'm so passionate about what I do, and I can't tell you how many women have come and cried to me about their birth stories. They told me about their birth and what happened and how they were disrespected and not listened to, and their husbands or partners were pushed aside as the woman's giving birth, and they're running out of the room and missing these special, precious moments. Various stories, but so many over the years that it's like, I really want to get to people before that point to educate you now before you get pregnant, but you know, so that you can start making those choices. So the other thing is that last piece is finding the best care provider, finding a good team for your birth. That would include a birth doula and or postpartum. Hopefully you could do both. Asking for help, calling upon your village. It takes a village. It's so much work for women. So really getting the partner involved, getting your family involved. It's just so many things. Anyways, make sure you have a good doctor or an awesome midwife. And if you'd like to connect with me, you can find me at pushsandiego.com. Love to hear from you. And if you have any questions, you can leave it in the comments below. We'll be happy to answer your question, and maybe we'll do a video on that. So
Yeah.
thank you so much, Elise, for your time
Thank
today.
you, Deb.
And we'll do it again soon.
Sounds good. Thank you so
Okay.
much.
Thank you.